So let's move on to rule number 20. Take responsibility when you witness wrong practices, i.e., know when to be a whistleblower. Do not think that this is not part of your responsibility because it is. Again, like we were talking about in the previous questions, not doing anything when you see something wrong happening or when something wrong is happening to you will never be the option. Um, it is your responsibility in the NHS and as a healthcare worker to report things and to take the appropriate action on things that are happening around you in your surroundings. Because if everyone decides that they don't want to take responsibility, then no one will be reporting anything and nothing will move forward. So just remember, this is how things are done in the NHS, or ideally. And this is the kind of attitude that you have to have when answering these questions. Let's look at this with the next question. You're working on the ward with a nurse, Penny, when you observe that she's not completing hygiene procedures correctly. You've seen Penny check dressings without putting on gloves and neglecting to use hand disinfectant before entering the ward. So this one is another one of the importance of the following considerations rather than the appropriateness. So the answer given is A, E, B, C, D. Let's see what that is. So A, the risk to patient safety if correct hygiene procedures are not followed. Yes, always, absolutely. Patient safety comes first. If you see patient safety anywhere and you're considering not putting it first or not putting it at least in the top two, think about it again, because patient safety is always your number one priority. Blindly go with patient safety. Next is the potential for other nurses to follow her example. Very true. She's a senior nurse with many years of experience, and if people notice this behavior, they might think it is appropriate to follow. So this comes before the patient's potential anxiety if they notice she's neglecting the use of gloves and hand disinfectant, because we're talking about, in option B, there's the patient's anxiety, which also fair, important. But in E, you're potentially talking about loads of people, not just one nurse, putting other people at risk and patient safety at risk at a larger scale because they stop using the hand disinfectant. And so that will be more important. And then after A, E, and B, we have C. Penny's experience working on the ward in comparison to you doesn't matter. The right protocol is the right protocol, and doesn't matter how long they've been working in this hospital, or if you're an FY1 and they're a consultant, or whatever it is. And the last thing would be that it is the responsibility of the infection control team to monitor and enforce hygiene procedures. No. So as I said, the attitude in the NHS that people want you to be going in with is that it is everyone's responsibility to correct wrongdoings, to correct wrongdoings that they've noticed, or there will be things that are skipped, there will be things that go wrong. And so if everyone is vigilant and everyone reports and, takes part actively in enforcing hygiene or enforcing other protocols, patient safety will be doing better than it would be otherwise. You can now pause and read the rationale for this last answer. And with that, we finished our 20 rules to navigate the SJT exam.